Mayor of Leominster, and this is our afternoon briefing. It is 2 minutes past the hour of 4 on March 20th, and this will get repeated not only on Access Television, but 95.1, which is WLPZ, a local radio station, and they will repeat it again not only today, but through the weekend, so you have up-to-date information. Also available by streaming at leominster.tv and WLPZ.org. First thing for the day is testing. Health Alliance Hospital at Leominster campus will begin doing the virus testing. So I want to make sure I'm not confusing anybody, but number one, it is located under, so if you went into the main entrance up front on North Main Street, you will see some signs to direct you. It's under the parking garage area, but you'll see the signs. First of all, you need to call your physician or a physician. And it has to be, the test has to be ordered by a physician. Then you must call. Once you have that order, you must call this number, 978-466-2627, to let them know that you're coming. So that way, you tell them what kind of car you have. They're going to be looking for you. They will meet you there, but they're trying to get this so it's orderly. It's, again, located under the parking deck at the main entrance, 10 a.m. to 2 p.m. Monday through Friday. This is to keep potential cases out of the hospital to minimize risk. Now, second location at Reliant on 117 near Walmart. Testing will begin on Wednesday, March 25th by appointment only. You can contact Reliant directly to determine eligibility. And what happens is no matter who you call, whether it's a physician at Health Alliance, your own physician, from whatever physician it might be, as well as Reliant, they're going to ask you a series of questions, and based on those answers, they will recommend that you be tested or not. So please, that's really critical that you know they don't want just people showing up to be tested, because they'll end up turning you away unless there's an emergency. The state of Massachusetts, the goal is 3,500 tests per day, which means that they have been doing the worst of the worst case scenarios for those that have been tested, that they feel physicians have recommended. But now with 3,500 tests and more each day, then that's going to allow us to do more testing, but also to those in the medical field as well as public safety. So those are real key things, and we'll repeat those over the course of the weekend. Today we did a conference call with UMass regarding childcare for emergency providers and those in the healthcare world. As you know, the governor has closed all childcare centers and daycare centers effective, I believe, Monday. But if we're going to have those on the front lines continue to serve and to continue to show to work and care for others, then we need to provide child care. So we were on a conference call today speaking to that very issue, and where, you know, there are some details that are not in place yet, but first we need to find locations, and there's a lot of work to do before they can put those together, but they're moving quickly on that. So we have 2 people assigned from city government to act as our leads for that project. We just followed up, superintendent, health department, city nurse, health department, our staff at City Hall, under 10 people, police, fire, and we just met at emergency management with Jim LeBlanc, who's the head of the Emergency Operations Center, just to go over sort of a recap of the week. What we're looking towards out another week. But remember, our jobs are to serve the public, but also to look ahead. And we do a number of what-if scenarios. So school has been called off for 3 weeks. We are at the end of week 1. And I'm not saying that they're going to extend that. What I'm saying is that we have to look even out further. We have to look down the road for the what-ifs. What if the hospital becomes full? Where do we go from there? How do we work with the hospital to help them? A bunch of different scenarios. Doesn't mean it's going to happen, and if anybody hears we're having those sorts of meetings, it's only because we're really planning down the road just in case. And that's exactly what pandemic plan was for the city, and we've rolled it out, and we've been pretty right on target, I'd say, 99%. You do have to do some updating to it and some tweaking, but it really does roll out the plan all the way to the point where if they find a cure and there is some sort of medication and cure for it, then it would be administered in an orderly way, and even that's been set up. So that's the kinds of meetings we've had. We're on a number of conference calls. After this update, the Hospital Health Alliance has their update. We participate in those. So thus far, 3,132 people have been tested in the state of Massachusetts. And as of yesterday, and the new numbers will be coming out very soon, any minute now, 328 positive cases as of yesterday. One death of an elderly man with underlying conditions in Suffolk County. And this is just a baseline. We expect, based on the fact that more testing will be available, we expect that the numbers of those testing positive, and remember, you can test positive without symptoms, will increase. And again, we'll have to go back statewide and community-wide. We'll have to go back and find out who those people came in contact with and then address the situation there. Looked like there was some rumors going around through the night about people getting this email saying that, inside sources telling them that we're going to be shutting down the state of Massachusetts, the whole country, all of those things. So I must have fielded about 35, 45 of those phone calls today. And so the governor at his press conference today said there are no plans to shelter in place. And the governor urges for people to only listen to official sources. So I did text the lieutenant governor this morning, so she was able to tell me that that was not the plan. So I was able to share that and be able to say that I had a good source and that was official. And then later on in the day, they had the press conference. So again, I don't want to oversimplify it, but assume that everybody you come in contact with has the virus, that every surface that you touch or get near has the virus, and it's been compromised, and then treat both accordingly. So all the preventative things that you keep hearing over and over and over again, washing your hands, keeping your distance. Just because they say 5 or 6 feet doesn't mean you can't make it 8. But there are some things that you can do. There are a number of things, activities, more and more free concerts that are coming on TV and via streaming through the internet. Dropkick Murphys were the first to do theirs the other night, but you'll see a lot more of those. It's a good time with the family to take out The Wizard of Oz and Home Alone and all those things that maybe you didn't get a chance to do over the holidays, and have some family time, which today gets splintered down to sometimes minutes or a drive to school or a pickup at the end of the day or a ride to soccer or whatever, because everyone is so busy. But there are things that you can do. It should be about 50 degrees tomorrow on Saturday, a little windy, but take all the precautions. Nothing wrong with you getting out, taking a walk, taking a hike on 26 miles of trails that we own. You can go to, hang on, I'll give you the updated numbers here. So these are the updated numbers. New numbers, 413 cases. It's up from 256, and there are now 19 cases in Worcester County. So clearly, as the testing goes up and more people are tested, then obviously we're beginning to identify more and more people. In the end of all this, it probably is likelihood at the end of this that everyone will know somebody or somebody's family who tested positive or was exposed to somebody who tested positive, and that is the likelihood by the fact that testing is going to bring up the number of those that test positive. So that's 413 cases. That's up from 256, but I have 328 here. I'm not sure what the conflict is here, but if it's 413, we have here from yesterday's, from the governor's report, that there was 328 yesterday. Here it says there were 256. So I'm not sure, but anyway, there are 19 cases. That's up from 14. So you can see the more testing, the more are identified and are testing positive. Partnership between Mass Hospital Association, Mass Medic and the Conference of Boston Teaching Hospitals. That's a new partnership. Tapping into the life sciences for donations of supplies for frontline emergency workers. More than 200 companies have responded in Massachusetts to the call out to help. There is a supplement to what the governor is doing. Any company, this is a supplement, I'm sorry. So this is sort of some of the things that came out of the governor's press conference today. Any company wishing to donate should go to www.massbio.org, or you could call our local emergency management. Okay, that's corrected. It's up from 326. So we're at 4 something, up from 326 from yesterday. There will be no evictions or foreclosures for the next 90 days, state of Massachusetts. The state small business program should be up and running next week. It will be administered by the Mass Development and will be for up to $75,000 as a low-interest loan for businesses. The fund will now climb to $20 million. If you have any questions, 978-534-7500, extension 0 is the number to call. The mayor's office on the weekends or any time of day up until about 8 at night. Emergency Management Agency number 978-534-7500. 5055 is their extension. The state hotline is 211. The school department hotline is 978-534-7700, extension 1341. They have been doing a fantastic job, the school department in Chartwell Culinary. Those are the people that run the cafeterias for us. They've teamed up, doing a great job, getting all the food out. They did almost 3,000 meals today to carry kids and families through the weekend. So that's quite an undertaking. So Monday through Friday, 7 to 9 in the morning, Fallbrook School, Drake School, Johnny Appleseed School, and the high school at the flagpole are all distribution areas. Business questions locally. If you're a business owner in town, you'd like to hook into City Hall, you can call Melissa Tasker at 978-534-7500, extension 3579. Business questions, you can go to the northcentralmass.com website or 978-353-7600. Meals on Wheels, 978-424-7548. And Leominster Veteran Service offices are still open. Remember, we are closed in terms of our physical locations, but we're fully staffed, so things that you cannot get online, and most everything is, you can come to City Hall or whatever municipal building. There are a list of phone numbers. Call one of those numbers, depending on which department it is. They will come outside, they'll meet you, and get you whatever you need, a form, permit. We're still doing inspections, but we're taking all precautions. If you need to call for an ambulance, if you need to call the police, they are going to ask you a series of questions about your health. Same thing with inspections. If you're calling for an inspector, your plumber, carpenter, whoever it might be calling for an inspection, we're going to want to know if anybody in the house is sick and what symptoms might be circulating inside that home. So anyway, back to Leominster Veteran Services, 978-534-7538. To file for unemployment claims, I would imagine it's pretty close to 100,000 that have been filed this week so far. Mass.gov/DUA. The Wi-Fi drive-in service at the library. If you'd like to pull into the rear of the library, they have free Wi-Fi set up if you need it. You can also go. Let's see. Veterans Center lot near the entrance, Senior Center parking spaces near the entrance, and you can check out leominsterlibrary.org. Senior shopping hours at Market Basket, at Shaw's, at Target. Target's reducing their hours till 9 p.m. Walmart is also doing Tuesdays for an hour before the store opens. Hannaford is pledging $250,000 to local food pantries, 60 and over. Shopping for high-risk people, 6 to 7 on Tuesday, Wednesday, and Thursday. JCPenney is closed temporarily, as well as all of the TJ Maxx companies, which include Home Goods and Marshalls. Kohl's is closed, and the best thing to do is to check those companies. There are a number of local companies that are still open and active, and we want to make sure that you do your best to shop local, and we have a list that I'll go through real fast for Keep Calm and Carry Out. Thank you for Melissa for putting this together. Here are the restaurants that are doing takeout. 435 Bar and Grill, Applebee's, Aroma Joe's, C&M Pizza, Central Cup, the Columbia Tavern, Comaquito, Christina's, the Daily Bagel, Domino's Pizza, El Chingaro, El Camino, the Gazba, Lemongrass, Moe's, Munchies To Go, North End Diner, Paisano's Pizza, Papagino's, Papu's Pizza, Pasta Land, Ryan Time, Say More, Ray's at Dandini Liquors, Shake and Dog, Slate, Tang Dynasty, Taquero, El Amigo, TC Lando's, Texas Roadhouse, Thai Jasmine, Tomato Pizzeria, and Uno Pizza and Grill, and the West End Diner are all participating. If you know of somebody else that needs to be on this list, by all means, let us know. Here's a business resource list that you can get on, all the links that you can get on the northcentralmass.com website. Tons of information that are there. A couple of things so you understand who we're consulting with and coordinating with: U.S. Conference of Mayors, Mass Mayors Association, the Governor's Office, FEMA, MEMA, Bloomberg Foundation, Mass Department of Public Health, MassDOT, United Way, Spanish American Center, UMass Health Alliance, all city departments, North Central Mass, Chamber of Commerce, just to name a few. We do between 3 and 7 of these conference calls daily, and they are very helpful, and we'll continue with those through the weekend. Governor Baker activated 2,000 National Guards who will support the communities and for equipment and logistics and warehousing. Federal government is working on a relief package. First drive-through test center is already opened in Shrewsbury. United Way is working on funds for workers. And we're trying to identify funds for those that maybe work in the server business, in the restaurant business, who might rely on tips and have found themselves without a job. There was a list, let me look for, because dentists had closed their offices. Let's see if I have that list. Because dentists had closed their offices, I think this is worth, I don't see it here, but if you give me a minute, it's really worth. Okay, I don't know what happened to it, but it really is worth me reading this. So the dentists in the area got together and realizing that there were a number of materials that were needed, masks and gloves, and they got together. And let me see if I could just find that list, because I do think it's worth. Over at United Solutions, they donated masks to the to Health Alliance. And today we got donations, and again, bear with me. This is worth reading off the list. These are all the dentists who ended up having to close down, and they donated 27 boxes of masks, 29 boxes of small gloves, 19 boxes of medium gloves, 9 boxes of large gloves, 2 packages of disposable gowns, 8 packages of Cava wipes, and they did all this on their own, and we picked it all up today. It's at the Emergency Management Center. I have the list. I'll read it off at our next briefing. I don't seem to have it here. I apologize, but here we go. It just showed up. Let's see. Want to thank. This was Dr. Todd Rowe's idea and Dr. Brian McDowell, Dr. Rowe, Dr. McDowell, Dr. Shamiri, Dr. Marion, Dr. Goldsher, Dr. Danino, Dr. Giannino, Dr. Nelson, Dr. Mario Albergerdi, I guess. I'm reading this, it's real small, I'm trying to blow it up. Dr. Begretti, Dr. Mossman, and Dr. Coakley, and Central Mass Oral Surgery. So they all donated everything they had on hand so that we could get this down into the Emergency Management Center and disperse it to police and fire, and some of that will go to Health Alliance. We identified in the shop area at the Center for Technical Education masks and other things that could be used. Those are on their way as we speak to Health Alliance so that they'll have masks. I know that there are a number of other businesses in town that have offered to make donations, whether it be food or supplies. Thank you, thank you. Keep those coming. And, you'd be surprised what we can use. And anybody that works anywhere where they may be using these masks, or you may have gloves and you have a good supply of them, by all means, let the Emergency Management Center know, and we will make sure we pick those up from you. We are pretty much up to date now. We will update you through the weekend if we need be. Other than that, watch our websites and watch our Facebook pages. Thanks to Carl and Bradley and Keith and everybody that's been coming in here to LTV to make sure that we could do these updates. Updates from at 9 in the morning and then at 4 in the afternoon. And then we also did our show yesterday. We want to thank all of our dedicated city employees, people who work at the school department, those people who are frontline in the healthcare industry, public safety. Want to thank all of them. Everything, I have to say, everything has gone extremely smooth. And people have been very patient, very helpful. But we want to thank all of our city employees. They are working hard along with the school department, public health, public safety, going above and beyond to try to service our customers and those people in our community. Hang in there. We're going to make it through. Things will come up. We'll get through them. We're working as a team 24/7. And again, we'll provide you updates through the weekend. So thank you. Stay safe. Stay healthy. Get out, enjoy the fresh air. Keep your distance. Again, assume everybody you come in contact with has the virus. Assume every material, every surface you touch is infected or compromised. And if you act that way and keep your distance, we will get through this and get through this faster. Thank you. Again.